I think the best advantage of having kids is that I can relate a lot to parents who bring them in. I can give some personal advice that way. Unfortunately, a lot of medicine is you read it out of a book, you practice it on some people, you see if it works, and you go from there. But when you have that personal experience of this is what I've done and this is what I've found to work with my kids, it just brings a bit of more of a personal aspect to the practice of medicine, and helps us to know what parents are going through when their child is not behaving, when they're not eating their food properly and whatnot. For OB, you not going through the process, of course, but I was able to see the difficulty that my wife went through, the pain of childbirthing and so on and so forth, and so it gives me a little bit more empathy, perhaps, for the women who go through that process. I think any day that I feel like I've actually helped a patient along, either in curing some illness that they're having. Recently I had a patient who had some benign paroxysmal positional vertigo, which is that spinning sensation. And I said, well, here, try this particular maneuver at home, where you roll on the bed and try to put the rocks that are out of place in your head in the right place. And he saw me in church here just yesterday and said, that worked great. I did it like once and I'm feeling better. I'm going to hang on to this. And so something of that sort where I get some immediate results definitely helps to make my day. I grew up reading a lot of mystery, Sherlock Holmes and other characters and authors like that. Now I'm actually reading quite a few of the book series that would be based around for like the teens and such. One, because I find them interesting, and two, it's kind of nice to know what my kids are going to be reading later on, so that if there's anything I want to guide them about, I know it's about that way. I try to read my Bible every day, as it's important to my spiritual life also.